Our liver is a remarkable organ. It works tirelessly behind the scenes, filtering toxins, producing bile and regulating our metabolism. But sometimes our modern lifestyles can take a toll on this vital organ. One such condition is fatty liver disease, a silent epidemic affecting millions worldwide. Fatty liver disease occurs when excess fat accumulates in the liver. This buildup can lead to inflammation and damage, impairing the liver's ability to function properly. What's alarming is that fatty liver often progresses silently, with no noticeable symptoms in its early stages. Many people believe that only those who are overweight or obese are at risk for fatty liver disease. While it's true that obesity is a significant risk factor, even individuals who appear slim can develop this condition. This is because the accumulation of fat in the liver is not always reflected in our outward appearance. While it's easy to assume that dietary fat is the primary culprit behind fatty liver disease, the truth is far more complex. In fact, sugar and refined carbohydrates play a more significant role in the development of this condition. When we consume excessive amounts of sugar, particularly fructose, found in sugary drinks and processed foods, our liver converts it into fat. This fat is then stored in the liver, contributing to the development of fatty liver disease. Moreover, refined carbohydrates such as white bread, pasta and pastries are quickly broken down into sugar in our bodies, further exacerbating the problem. Over time, this constant influx of sugar overwhelms the liver, leading to fat accumulation and inflammation. To understand the link between sugar consumption and fatty liver disease, we need to delve into the role of insulin. Insulin is a hormone produced by the pancreas that regulates blood sugar levels. When we eat, especially carbohydrates, our blood sugar rises, triggering the release of insulin. Insulin acts like a key, unlocking cells to allow glucose, sugar, to enter and be used for energy. However, when we consume excessive amounts of sugar and refined carbohydrates, our cells become resistant to insulin's effects. This insulin resistance forces the pancreas to produce even more insulin to keep blood sugar levels in check. High levels of insulin in the bloodstream signal to the liver to store fat. This, coupled with the liver's increased conversion of sugar to fat, creates a perfect storm for fatty liver disease to develop. Section 4. Belly fat, a visible warning sign. While fatty liver disease often progresses silently, one visible indicator of potential trouble is belly fat. Excess fat stored around the abdomen, also known as visceral fat, is a sign that our bodies are struggling to regulate insulin and store fat properly. Men with a waist circumference greater than 40 inches or 102 centimeters and women with a waist circumference greater than 35 inches or 89 centimeters are at increased risk for fatty liver disease and other metabolic disorders. This is because visceral fat is metabolically active, releasing hormones and inflammatory substances that contribute to insulin resistance and inflammation throughout the body. Measuring your waist circumference is a simple yet effective way to assess your risk. If your waistline exceeds the recommended thresholds, it's essential to take steps to reduce visceral fat and improve your metabolic health. Section 5. Taking charge, tips for a healthy liver. The good news is that fatty liver disease is often reversible with lifestyle changes. Here are some tips to help prevent and manage this condition. First, reduce sugar and refined carbohydrate intake. Limit sugary drinks, processed foods, and refined grains. Focus on whole, unprocessed foods like fruits, vegetables, lean proteins, and healthy fats. Second, manage your weight. Losing even a small amount of weight, especially belly fat, can significantly improve liver health and insulin sensitivity. Third, exercise regularly. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Fourth, limit alcohol consumption. Excessive alcohol intake can damage the liver. If you choose to drink alcohol, do so in moderation. Remember, your liver is a resilient organ, and by making positive lifestyle changes, you can help it heal and function optimally. Small changes can make a big difference in the long run.